Pleasure to be here. And just to emphasise that the PCREF is a race, equity and accountability framework. It is indeed a recommendation from the Mental Health Act review and was seen as one of the key levers being brought forward to help co-produce with communities and systems something that would help to transform the racialised experience. So I just want to contextualise that in terms of NHS England's approach to tackling inequalities in mental health. We have the 5-year forward view for mental health and the long-term plan for mental health. I was involved in both of those and still am in terms of implementing those recommendations. I was the co-chair of the 5-year forward view task force. The Advancing Mental Health Equality Strategy, published in October 2020. We have an Advancing Mental Health Equalities task force, of which there are 3 key areas for attention. One is helping local health systems to improve. 2 is making sure data and intelligence is used robustly and is of really good quality to inform decision making and thinking. And 3, to improve the workforce. These are some of the mechanisms about how we are advancing mental health equalities. And core to that strategy is the PCREF, the Patient and Carer Race Equality Framework. So it's essentially to improve racialised experience of mental health services in terms of access, experience and outcomes. And the name, the clue is in the name. Absolutely vital and central to that is the voices, the lived experience of patients, carers and communities to help and shape the service transformation that is required. Just to have a look at why it's so important to actually change the trajectory of the experience of racialised groups. If we can see a dashboard, the mental health dashboard, which NHS England has created to help assist us on this journey, where you can see the implementation of the Mental Health Act by some of the sections you may know, Section 2, Section 3, Section 135, Section 136. And you can actually see on the slide in terms of the proportion of people from Asian and Black communities receiving the most coercive forms of detention under the Mental Health Act. So, for example, 21.5% of people from Black communities receive community treatment orders across England. And the pattern is it's varied, but it's very much the same in terms of that racialised experience. So an overview of the PCREF. 3 key parts. One is the statutory and regulatory requirements, which it demands a robust level of leadership and governance in order for us to be able to pursue this systematic race equity agenda transformation. And then part 2, which is around organisational competencies. And key to that is around how we work in collaboration and with communities around cultural awareness, staff knowledge and awareness, partnership working, essentially co-production and co-learning. And we have 4 pilot sites that we started with. South London and Maudsley is one of our initial pilot sites that we've worked together to help to develop the guidance to support the PCREF and allow and support trusts across the country when it becomes mandatory, the PCREF in the next financial year for all mental health trusts. To have a PCREF to provide evidence in each of the Part 1, Part 2 and Part 3. Part 3 is really critical because that's where you now have feedback from service users, carers and community members about the quality and nature of the services that they're receiving, both in terms of outcomes, and we're looking to identify the ones which are best clinical outcomes which best help to demonstrate improvement in outcomes and experience, as well as a kind of TripAdvisor patient feedback tool digital tool that we're developing. And right, as I said, at the key of this is working as the steering group nationally is with service users, carers, as well as a range of stakeholders, including the CQC and the EHRC, who are embedding within their single assessment framework and their well-led leadership attention to the PCREF. So I've mentioned already part 1, leadership and governance, and that's about accountability and statutory and regulatory obligations. Part 2, which is around organisational competencies, around cultural and practice change. And part 3, the heart of the PCREF, which is around a patients and carers feedback mechanism.
Perfect timing. Thank you, Jacqui. And I just wanted to say it's a particular honour to be here, and particularly significant because in 2009, when I was the Director of Strategy at South London and Maudsley, I and my colleagues in Guy's and St Thomas's, King's College Hospital and the university set up the KHP strategy and got it on its way. So it's fabulous to see it now and the progress it's made. So we're about reimagining mental health services for black service users and carers and keeping on going to demonstrate anti-racism in practice. I won't read out the full statement that the Trust has committed to, but this has been published on our website, and it sets out how we're going to be defining anti-racism with PCREF, i.e. anti-racism is about action. So it sets out that the Trust intends to remove the conditions that hold systemic racism in place. And these are the conditions where bias and prejudice is built into systems, policies, processes, resource flows, practices, and crucially getting into some of the heart of the issue around relationships and connections, power dynamics and mental models. So this sets out how the Trust will be going forward and in every element of its whole organisation developing action plans. So we're talking about collaboration and partnership here and transforming human health through it. And I wanted to sort of start off by saying, obviously for us, PCREF is a partnership. Everything we do involves counting to 3, the service user and carers, community leaders and staff, and keeping the involvement and views and perspectives in balance. To do this, working on governance is absolutely crucial. But the thing to remember is you're never going to get it right, because the fact of the matter is that there is a power imbalance through ethnicity, size, status, power, hierarchy, and so it's a constant work in progress. One of the things that we've got in our local PCREF is a powerful independent element, and we see this as essential to have in our governance if we're going to have credibility with the local black citizens we're here to serve. And of course, fundamentally, it's got to be led from the top. And that's why it's so fabulous to have Norman and David right behind us in this journey. And it's got to be locked into the Trust's mainstream governance and routine monitoring to ensure success. So anti-racism in practice is about taking a whole organisation approach. Some key elements here: you have to get it right for the workers and the people we serve at the same time. It's not an either or. To state the obvious, which we all know, every system is perfectly designed to get the results it gets. And the results of our system at the moment is that black citizens, that's black African, black Caribbean people primarily, get poorer access, experience and outcomes. So there's this real commitment to tackle the conditions that are holding this problem in place. I've outlined them to you before, I won't rehearse them again. But you've got to work on all aspects in order to shift this fundamental problem. And the Trust Strategic Anti-Racism Plan will list out the steps to tackle these conditions. So my final slide is about triple leadership driving the change. So we really are working in collaboration and partnership and demonstrate it in practice. So we're trusting the process to get it right. Service users and carers, community leaders and staff have come together in borough-based problem-solving teams to develop and test out our ideas that will embed the organisational competencies that Jacqui spoke about and eliminate racial disparity in local services. Budget and decision-making has been devolved to these teams and they're getting on with it. Fundamentally, though, we need to ensure co-ownership of the evaluation framework, because I'm sure you've all got experience of your scientific evidence having proven something, but those who are outside your community don't believe you, don't understand it. So we're working with a community-led concept of developmental evaluation and lining it up with our QSEN colleagues so that everybody is signed up to tackling progress in this way and adjusting and changing the change ideas to ensure that they deliver the improvements we want to see. We've got hard metrics in there as well as, of course, as qualitative components. So just to finish by saying that by autumn 2024, every member of staff, all 5 and a bit thousand of us, will have spent time thinking about the organisational competencies and how best to eliminate racial disparity in their practice. And the conditions will then be set for success and for the Trust to be leading anti-racism in mental health by 2026. So thank you very much.